To describe it in 3 words, it's a simple, it's safe, and it's scalable.
I see this project as patient-centred, simple but very effective.
It is smart, it's simple, and it saves time.
The National Clinical Programme for Trauma and Orthopaedic Surgery was formed in 2013 to develop change initiatives which would improve access and care for patients who go into acute hospitals for the trauma and orthopaedic service. We published our model of care in 2015, and the trauma assessment clinics was one of the innovative projects which was included in the model of care.
It's difficult for people to get to trauma clinics. They have to find someone to mind the children. It could take 7-8 hours to get here, to park, to sit outside, to have an x-ray, to have another x-ray, to see a doctor. There's no real efficiency in that at all, in that people have to wait so long to be seen. And as well as that, then it's a poor utilisation of our time as doctors and nurses. So we've determined that we can possibly not bring 30 to 40% of the people into the clinic here. We could look at their x-rays and decide a plan of management, and then contact them.
The benefit of the project demonstrated that capacity could be released to A, do something extra with the staff, and B, actually improve the patient experience from the trauma perspective. So I immediately made contact with our orthopaedic team. The ideas merged, and from that the orthopaedic team took on board the concept and the idea, researched it, and came forth with a proposal which was easy to approve, and we took it from there.
To get a project like this off the ground, I suppose you need to look for team players and who wants to involve themselves in it. You bring people on board who can actually help you lead out the project.
So Mr. Sheehan asked me would I come on board, and I was very happy to do so. Anything that can bring about a change and improve the quality of service to our patients is to be welcomed.
Since the end of May of this year, physiotherapy became directly involved and run a clinic each week where at the trauma assessment clinic, those patients who are deemed appropriate for physiotherapy, we take responsibility for these patients.
The therapy is initiated in the emergency department, and therefore we had great assistance from our ED colleagues here in the hospital with regard to that. And I suppose if we buy in from all these people, it just made sense that it was a better use of patients' time and a better use of our time, and as such it's a win-win situation.
The trauma assessment clinic is suitable for patients with simple, stable injuries. This is an ideal setting in which they can get a senior opinion, and while that opinion is happening they can sit at home and rest their injured limb. Sometimes patients are back at their desk at their computer working. In the background we are working, getting the opinion, telephoning them with the advice, and all of this happens by senior healthcare professionals.
Change is always the challenge. So how do you get about change? Again, we go back to clear leadership. There was a lot of engagement at the front end of the project, and then from that engagement staff identified the systems and the adaptability that they would have to put in place to actually make this happen.
One of the benefits of the project really is that we've done patient satisfaction surveys, and the patients are quite happy with it. As I've said, they've embraced the concept quite early on and do understand it. The benefits to the staff here is that we tend to be able to see more patients more efficiently in a lesser period of time. It affords us time to see patients that are waiting to see us for hip and knee and back problems, and we can see these patients as well. You could run this clinic remotely, it can be run online, it can be run in a different jurisdiction. So there's huge scalability in the project as well.
To be shortlisted to the finalists has to be one of the proudest moments of my role thus far in Tullamore. To be a finalist is a tremendous honour, but it's testament to the work and the team effort that exists in Tullamore Hospital.
From the top to the bottom, there's been tremendous teamwork in getting this trauma assessment clinic running so well and benefiting patients.